So today class is new chapter that is called urinary anti-infective agents. So what is urinary anti-infective agents? Urinary anti-infective agents are the drugs that are only used to prevent or treat the urinary tract infections or UTI. That is urinary anti-infective agents are the drugs which are used to treat only the urinary tract infection. That urinary tract infection is caused by a variety of bacteria. Urinary tract, it is a common infection. It is a common infection caused by a variety of bacteria. Basically, the most common bacteria which cause the UTI or urinary tract infections that are Escherichia coli, Pseudomonas aeruginosa. Escherichia coli, Pseudomonas aeruginosa, Klebsiella pneumonia. Klebsiella pneumonia. So these are the very common bacteria which can cause the UTIs. UTIs. So basically, that urinary anti-infectives are used for the following conditions. See here, I mentioned here that is bladder infection, kidney infections, or renal infection, otitis media infection, or pneumocytosis pneumonia, and prevention of the bladder infection. Next, go for the transurethral prostatectomy, urinary frequency, urinary tract infection, and in case of male, uh, urethritis, prostatitis, urethritis, prostatitis, and bladder infection. So, urinary anti-infective agents are used basically for the bladder infection, renal infection, otitis media, then pneumocytosis pneumonia, prevention of the bladder infection, transurethral prostatectomy, urinary frequency, urinary tract infection, and prostate infection or prostatitis, and urethritis. These are the therapeutic uses of urinary anti-infectives. यूरिनरी एंटी
सर ये ओटिटाइटिस मीडिया क्या होता है सर?
ओटाइटिस मीडिया मीन्स हम लोग का दैट इज ईआर ईआर पे जो ये होता है ना, ओटाइटिस मीडिया एक पार्ट है ईआर का, कान कान का अंदर में एक पार्ट है, तो उसको बोलते हैं ओटाइटिस मीडिया. इन मोस्ट ऑफ द केसेस दैट एरिया विल बी इन्फेक्टेड विद द बैक्टीरिया ओनली, सो दैट इज कॉल्ड ओटाइटिस मीडिया. देन गो फॉर क्या हो गया. Next, classification of the urinary anti-infective. You see, that is the drugs which are used to treat the UTIs. UTIs means urinary tract infection. So they are basically called as urinary anti-infectives. They are classified into the following groups. You see here, quinolones derivatives. Quinolone derivatives. See, quinolone derivatives. Next, nitrofurantoin. Nitrofurantoin. So urinary anti-infectives are classified into the following groups. See, quinolones, nitrofurantoin, aromatic alpha hydroxy acid derivatives. That is example mandelic acid, methenamine, and sulfonamide. These are the drugs which are used to treat the urinary tract infection. Either it is in case of male or female infection. Quinolones, nitrofurantoin, aromatic alpha hydroxy acid derivatives, example mandelic acid, methenamine, sulfonamide. Now first I am going to start the quinolones. See, fluoroquinolones are the antibiotics that are most commonly used to treat the variety of the illness such as respiratory, urinary tract infections. Means fluoroquinolones. Fluoroquinolones are the antibiotics that are commonly used to treat the respiratory tract infection and urinary tract infection which are caused by a variety of the gram positive or gram negative bacteria. So in case of fluoroquinolones, the most important fluoroquinolones which are used to treat the infection are ciprofloxacin, gemifloxacin, levofloxacin, moxifloxacin, norfloxacin, ofloxacin. So these are the important fluoroquinolones or quinolones derivatives which are used to treat the respiratory tract infections or urinary tract infections. That is ciprofloxacin, gemifloxacin, levofloxacin, moxifloxacin, norfloxacin, ofloxacin, gatifloxacin. These are the important fluoroquinolones. Next, about the historical background of the quinolones. Historical background of the quinolones. Under this historical background of the quinolones, we can discuss discovery and development. See here, quinolones are antibacterial agent. Quinolones are antibacterial agent as they are active against the either gram positive or gram negative bacteria. That's why they are known as antibacterials. And these are basically antibacterial will as they can act as a model of antibiotic. Means either they can prevent the protein synthesis or cell wall biosynthesis or enzyme inhibitors. This is due to their broad range of activity, high potency, and good bioavailability with both intravenous and oral administration is possible. Means these these fluoroquinolones, they have the broad spectrum antibiotic. Means they can active against gram positive and gram negative bacteria. So they are, that's why they are broad spectrum antibacterial agent. And they have the good bioavailability. They have good bioavailability with intravenous route or oral route. Now, the timeline of this class of fluoroquinolones or antibacterial agent begins with the isolation of bactericidal naphthyridine. That is the first, quinolone derivatives or antibiotics was discovered is called as nalidixic acid. Nalidixic acid, which is discovered in 1960s by George Lasser George Lasser as the first synthetic quinolone antibiotic. Remember, the first synthetic quinolone antibiotic is called as nalidixic acid. Nalidixic acid, which is discovered by George Lasser. George Lasser in 1960s. In 1960s, and this is a derivative of naphthyridine nucleus. It has the naphthyridine nucleus, means it consists of naphthyridine. Naphthyridine means here one benzene ring is attached with the naphthalene ring. One benzene ring is attached to the pyridine nucleus. Means when two benzene ring is attached, that is called naphthalene. Now, when the one benzene ring is attached with the pyridine nucleus, that is called naphthyridine nucleus. So, nalidixic acid is consists of naphthyridine nucleus, and this is coming out of the quinolone derivatives. Now, the nalidixic acid is a byproduct was isolated from the chloroquine synthesis. Means nalidixic acid actually it is obtained when the chloroquine is synthesized. It is a byproduct of chloroquine. So the first quinolone antibiotic discovered, that is in 1960s. The name is nalidixic acid, and that is discovered by the George Lasser. George Lasser. This is the structure of nalidixic acid. You see, this nitrogen. If this nitrogen, both nitrogen are removed, instead of nitrogen, if it is carbon, then it becomes naphthalene nucleus. Means here two carbon atom is removed with the nitrogen atom. That's why this ring is called naphthyridine nucleus. Naphthyridine nucleus means both are become pyridine. So that's why it is called naphthyridine nucleus. So what is the basic, what is the clinical use of the nalidixic acid? Basically, the nalidixic acid was to treat the urinary tract infection caused by the gram-negative organism. So the nalidixic acid is the first quinolone synthetic derivatives which are used to treat the urinary tract infection and discovered by the Lasser in 1960s, and it is active against the gram-negative bacteria. Now, the successive generations of quinolones had the activity against the both gram-negative and gram-positive bacteria. See, this is the first quinolone synthetic drug which are only used to treat the gram-negative infection. Now, the modification of this nucleus generate a number of derivatives which active against both gram-positive and gram-negative bacteria. That is the modification of the naphthyridine nucleus or nalidixic acid lead to develop a number of quinolone derivatives which are active against both gram-positive and gram-negative bacteria. Now we are going to see how we can modify this one. Now the development lead to the fluoroquinolones derivatives. Fluoroquinolones derivative means if you modify this nucleus, then it will give one newer derivatives, that is fluoroquinolone derivatives. You see here methyl group is there. Now you remove this. Methyl group with the fluorine, then it becomes fluoroquinolones. That you see this nitrogen, here nitrogen is there, That is basically if you put here carbon, it becomes quinolone nucleus. If you replace this methyl group with fluorine, that becomes fluoroquinolones. Now the modification of the nalidixic acid by the introduction of the fluorine, it will lead to develop a newer fluoroquinolone derivatives. Now we see the structure. Generally, the quinolone class of molecules, which is we told 4 quinolone 1,8 naphthyridine ring structures. The naphthyridine ring structure differs slightly from the 4 quinolone due to the presence of the 2 nitrogen atoms. You see here. See, I told already now here you see that is modification of the nalidixic acid will lead to the fluoroquinolone derivatives. You see here this nitrogen, you see here. If X is carbon, but in case of nalidixic acid, here X is nitrogen. If here X is carbon or CR8, for example, means you see if X is carbon, then here another R will be put as a R8, then it becomes quinolones. If it is X is N, then it is naphthyridones. So nalidixic acid is a nalidixic acid contain here nitrogen and nitrogen. So it is a naphthyridine nucleus. That is nalidixic acid consists of naphthyridine nucleus. Whereas quinolone means if it is quinolones, that here instead of nitrogen it becomes carbon. So that is called as quinolone derivatives. Now the modification of the nalidixic acid or naphthyridine nucleus by introduction of carbon here, then it will lead to develop a quinolone derivatives. See, here in case this is a naphthalene nucleus. If we modify this structure, means if we introduce carbon atom here instead of nitrogen, it becomes quinolone derivatives. It becomes quinolone derivatives. You see, this is the quinolone derivatives. Now, substitution of R1, R5, R6, and R7 lead to develop a newer derivatives of quinolone. Lead to develop a newer derivatives of quinolone. You remember the first quinolone derivatives, nothing but naphthalene derivatives discovered, that is called nalidixic acid. Now the modification of the nalidixic acid by introduction of the carbon instead of nitrogen, it will lead to quinolone derivatives. Now the substitution of the different position of the quinolone, it will lead to develop a number of the derivatives which are coming out of this. You see, the first fluoroquinolone to be developed was flumequine. You see, this is the first fluoroquinolone drugs. The name is called flumequine. So it had a fluoro group at the C6 position. See, it has a fluoro group at C6 position. This is the quinolone. This is a quinolone nucleus. See, in the C6 position, if it is fluorine, that is known as fluoroquinolones. That is known as fluoroquinolones. The first fluoroquinolones drug is called flumequine. Next, go for development. After discovery of the fluoroquinolones, that is flumequine. Further, the modification of these quinolone nucleus lead to develop a number of the fluoroquinolone derivatives. So how it will develop? You see, the development of the quinolone or fluoroquinolone drugs is categorized depending upon the drug. First generation, second generation, third generation, and fourth generation. Means after discovery of the first fluoroquinolone derivatives, flumequine, subsequently develop a number of fluoroquinolones which are classified into first generation fluoroquines, second generation fluoroquines, third generation fluoroquines. See, the first generation shows the first generation of fluoroquinolones shows the activity against the gram-negative bacteria caused the urinary tract infection. Remember, the first fluoroquinolones only active the gram-negative bacterial infection caused the UTIs. Now, the second generation showed the enhanced activity against the gram-negative bacteria and improved activity against the gram-positive also. Remember here, the that is, remember, first generation fluoroquinolones active against gram-negative bacterial infection, whereas the second generation fluoroquinolones shows the good activity against the gram-negative bacteria and improve the activity against the gram-positive bacteria also. These enable the list of conditions that quinolones could treat to expand. The generation delayed improved the pharmacokinetics due to the use of C7 piperidine substituent. Means this activity means the second generation shows the gram-negative activity against the gram-negative bacteria, but it also improves the gram-positive bacterial activity as substitution in the C7 position. Means introduction. It is mainly due to the introduction of the piperidine substituent at C7 position improve the activity of second generation fluoroquinolones against gram-positive bacteria. समझ में आ रहा है? Remember, The second generation fluoroquinolones basically shows the good activity against the gram-negative bacteria, and it also shows the activity against the gram-positive bacteria as introduction of the introduction of the piperdinyl substituent at C7 position. At C7 position. That is, here in case of R6, here fluorine group is there. Fluorine group is there. That is here. Uh, uh, Fluorine group is there. You see here C6. The C6 fluorine group is there. So it will show the activity against the gram-negative bacteria. But if you introduce the piperidonyl functional group as R7, it also shows the activity against the gram-negative bacteria. Gram-negative bacteria. Now, third generation provide the improvement in efficacy in inhibiting the gram-positive and anaerobic pathogen. See, subsequently, I told the first generation fluoroquinolones shows the activity against the gram-negative bacteria. The second generation fluoroquinolones shows the activity against the gram-negative bacteria, but it also shows the activity against the gram-positive bacteria as introduction of the piperidonyl substituent at C7 position. Now, the third generation provide the improvement in efficacy in inhibiting the gram-positive as well as anaerobic pathogen. Means the third generation fluoroquinolones having the good efficacy for inhibition of the gram-positive as well as anaerobic pathogen. And the fourth generation fluoroquinolones dramatically increase the activity against the DNA guidase and gram-positive microbes and improve the pharmacokinetics and pharmacodynamics activity. Now you see, now among these first, second, third, and fourth generation, the fourth generation drugs are more active among all the generations. The fourth generation drugs or fourth generation fluoroquinolones are more active. They have the activity against the DNA guidase enzymes for gram-positive microbes and also improve the pharmacokinetics as well as the pharmacodynamics activity of the fluoroquinolones. Now I am showing you, see here. See here. What is the major fluoroquinolones which are coming under the second generation? See here. Norfloxacin, you see, the major changes were the addition of the fluoro group at the C6 position in the ring substituent at C7. Norfloxacin, see, second generation, you see, I am saying, second generation was ciprofloxacin. The second generation, in the second generation, the first fluoroquinolones was ciprofloxacin. Ciprofloxacin. The first quinolone to have the activity observed beyond the treatment of UTIs. Currently, gerinoxacin, fourth generation. Example of the fourth generation fluoroquinolones. Garanoxacin. See example of the norfloxacin. Norfloxacin is the first generation. Example of the first generation fluoroquinolones, norfloxacin. Second generation fluoroquinolones was ciprofloxacin. Then garanoxacin is the fourth generation. I will discuss third generation. So this is the structure of the 1, 2, 3. Which one means what? Norfloxacin. This is called norfloxacin. This is norfloxacin. This is ciprofloxacin. This is gar-enoxacin. Gar-enoxacin. So the modification of the nalidixic acid or naphthalidine nucleus subsequently develop the quinolone nucleus. After develop from the quinolone nucleus, then substitution of the quinolone nucleus, it will lead to development of a number of fluoroquinolones derivatives. That is ciprofloxacin, norfloxacin, gar-enoxacin, gatifloxacin, moxifloxacin, ofloxacin. So subsequent development of the fluoroquinolones lead to develop a number of the fluoroquinolone derivatives such as ofloxacin, norfloxacin, ciprofloxacin, moxifloxacin, gatifloxacin, lumifloxacin. So these are the important fluoroquinolones which are used to treat the urinary tract infection. In next class, I will show the details for first generation, second generation, third generation, and fourth generation fluoroquinolones classification. हेलो, समझ में आया कुछ? ठीक है, हेलो अभय कुमार गुप्ता।
Yes, sir.
हाँ, तो ये था डिस्कवरी एंड डेवलपमेंट ऑफ दी फ्लोरोक्विनोलोन्स। सो नेक्स्ट क्लास में फ्लोरोक्विनोलोन्स का क्लासिफिकेशन बता दूंगा। फर्स्ट जनरेशन कौन सा है एग्जांपल है, सेकंड में कौन सा है, थर्ड में कौन सा है, ठीक है, फोर्थ में कौन सा है। एक्चुअली बेसिकली यहाँ पे फोर्थ जनरेशन एंड थर्ड जनरेशन फ्लोरोक्विनोलोन्स आर मोस्टली यूज्ड। सो नेक्स्ट क्लास में डिस्कस कर दूंगा। अभी आज डिस्कवरी एंड डेवलपमेंट में बोल दिया, ठीक है। हाँ बोलो, अभी कोई क्वेश्चन है पूछो मुझे। है मेरा एक क्वेश्चन है तुम्हारे पास।
यस सर।
सर पूछो।
हाँ बोलो, तुम लोग यूरिनरी ट्रैक्ट इन्फेक्शन पढ़ाई करके आया था पैथोफिजियोलॉजी में?
सर अभी पढ़ाते हैं नहीं सर।
अच्छा, यूटीआई नहीं पढ़ाया?
यस सर, पढ़ा नहीं।
नहीं तो फ्लोरोक्विनोलोन तो पढ़ा है, मतलब यूरिनरी वो नहीं पढ़ा है।
नहीं, ये तो
सर
पैथोफिजियोलॉजी
ना डीपली नहीं पढ़ा था, मतलब अगर उसमें भी
नहीं, पैथोफिजियोलॉजी में तो है यूटीआई, उसका पैथोजेनेसिस, साइन एंड सिम्टम्स
है तो अभी पढ़ाया नहीं है।
अभी नहीं, पैथोफिजियोलॉजी सेकंड सेमेस्टर में, बीफार्म सेकंड सेमेस्टर में था ना पैथोफिजियोलॉजी सब्जेक्ट, वहां पे तो पढ़ाया था ना।
यस सर था।
तो मुझे अभी एक क्वेश्चन बोलो, मोस्ट ऑफ द यूटीआई इज हैपन इन केस ऑफ मेल और फीमेल।
सर क्या सर, क्वेश्चन रिपीट करिएगा।
रिपीट करो।
यूरिनरी ट्रैक्ट इन्फेक्शन ज्यादा फीमेल में होता है और मेल में होता है?
फीमेल में।
क्यों?
सर फीमेल में ही होता है।
क्यों होता है ज्यादा?
सर मेंस्ट्रुअल साइकिल की वजह से कुछ।
नहीं 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 नहीं, आंसर ये नहीं, इसीलिए मैं पूछ रहा हूँ क्यों। ये बहुत बहुत बेसिक क्वेश्चन है यार। मैक्सिमम मेल फीमेल में यूटीआई होता है, मेल में नहीं होता इतना, क्यों मालूम है? तुम लोग को आंसर मालूम है और नहीं है? बोलो जल्दी बोलो।
नो सर आप ही बताइए।
हाँ बोलो। सुनो, एक्चुअली क्या होता है, ये एनाटॉमिकल रीजन है। एक्चुअली इन केस ऑफ फीमेल यूरेटर शॉर्ट होता है। इन केस ऑफ फीमेल द यूरेटर इज वेरी शॉर्ट, whereas the male ureter is long. So when the bacteria enter into the bladder, so they are unable to travel from the bladder to the kidney in case of male, as the ureter are very long in case of male. So from the bladder the bacteria unable to travel to kidney. That's why in case of male the urinary tract infection is rare, but due to the shorter ureter The bacteria can easily travel from the bladder to the kidney in case of male, and they cause frequent infection. They cause frequent infection due to the shorter or shortness of the ureter. Due to this, the bacteria can be easily transferred or travel from the bladder to the kidney and infect the kidney as well as the ureters. समझ में आया है? हेलो,
यस सर, आया समझ में।
हाँ बस ये कारण था। ठीक है, अभी और कुछ डाउट पूछो। अभय कुमार पूछो मुझे, तुम्हारा
यस
डाउट
सर।
पूछो मुझे, कोई डाउट है तो क्वेश्चन पूछो, जो भी सब्जेक्ट से पूछ लो। कुछ डाउट है तो बोल दो। तुम्हारा वीडियो ऑन करो, ऑन करके पूछो। कोई डाउट है तो कोई किसी का क्वेश्चन बोलो। यहाँ पे पावर ही नहीं है, ये लाइट नहीं है, इतने देखो इतना गर्मी लग रहा है कॉलेज से। यहाँ पे तुम समझना नेफ्थैलिन न्यूक्लियस और फ्लोरोगुइनोल न्यूक्लियस, ये समझना। नेफ्थैलिन न्यूक्लियस मींस क्या होता है? नीचे देखो यहाँ पे, ये फिर ये देखो नेफ्थाइरिडीन मींस, तुम सोचो ये दो नाइट्रोजन नहीं रहेगा तो क्या होगा? नेफ्थैलिन, नो? Basically, you know, when the two benzene ring is attached, then it is called naphthalene. Now, in naphthalene, from naphthalene, if you remove the carbon and put the two nitrogen atoms, so it becomes a naphthyridine nucleus. Naphthyridine, as because this is become pyridine, this is become pyridine. So that's why it is called naphthyridine nucleus. And quinolone means here instead of nitrogen, here carbon is there. That is called quinolone nucleus. Quinolone nucleus. So when the quinolone nucleus contain fluorine group at C6 position, that is called as fluoroquinolones. That is known as fluoroquinolones. अब क्लियर होगा न्यूक्लियस? अभी घोल के जाके पढ़ो, समझ में आ जाएगा। ठीक है, हाँ ठीक है, आज इतना तक ही तक लिख करो।